Hi, I'm Sharon Moore from Wellspoken. Here's a little video about speech pathology and where myofunctional science fits into that. We're going to chat about speech pathology first to give a little context about the broad scope of a speech pathologist's work and also where myofunctional fits into a speech pathologist's daily work, if at all. And many people simply don't know what a speech pathologist does unless they've had reason for themselves or someone they know to need a speech pathologist help. The profession draws on many fields of knowledge, and you may be surprised to learn about the incredible scope of practice, assessing and treating a broad range of human communication and swallowing problems across the lifespan. Yes, babies to advanced age. Communication problems are categorized such as voice, articulation, fluency, or language disorders, and may be caused as part of development or may happen due to injury or illness or with a medical diagnosis. Communication and swallowing difficulties can impact every aspect of daily life, be it with family, community, education, in the workplace, or in social situations. You may also hear speech pathology referred to as speech therapy. That's the official terminology used in the UK. Speech language pathology is the term used in the US. Speech pathology is Australian, orthophoniste in France, and the list goes on. Now, a few facts to think about are currently more than 1.1 million Australians have a communication or swallowing problem. Roughly the same number as those living with diabetes and 3 times the number of Australians who suffer from dementia. 1 in 9 Aussie preschool children stutter, and without intervention by a speech pathologist may suffer long-term social and economic distress. Adults aged 34 years who had a language impairment at the age of 5, they're 7 times more likely to have poor reading skills or 5 times higher odds of mental health difficulties and 3 times the odds of unemployment. Now, people seek help from a speech pathologist for many reasons, like difficulty expressing themselves or being understood, like children with delays developing speech and language, or someone after a stroke, someone whose voice is not working well or their words won't come out fluently, like stuttering, or a person with a hearing impairment, just to name a few. Now, in Australia, speech pathology is a 4-year Bachelor of Science degree, or for some, it's a postgraduate master's that results in the ability to assess, diagnose, and treat a range of communication and swallowing disorders across the lifespan. Academic components combine topics like audiology, linguistics, psychology, phonetics, aspects or many aspects of medical science like anatomy, physiology, neuroanatomy, and so much more. There are many hours of supervised clinical practice before a speech pathologist graduates. All new graduates are encouraged to work in supported or mentored positions to ensure they can consolidate their undergraduate skills. Please note here that qualification criteria really varies from country to country, and active learning and professional development continues throughout a speech pathologist's career. It is a requirement for them to be eligible for membership with our peak national body in Australia called Speech Pathology Australia. Now, more about speech pathologists, well, they may work as a generalist, treating a range of problems, or may develop pockets of expertise in particular areas of practice, like myofunctional science, for example, because of opportunities they've had in their training or workplace, because they've been inspired by a teacher or mentor, or because they have a personal connection, like a sibling with autism, or a parent who's had a stroke or hearing impairment, or because they've developed a passionate interest in an area like singing, for example. Now, being able to work with orthodontists and dentists, that requires extra study. And there are many courses available to speech pathologists wanting to pursue this line of myofunctional science training. But you can check out our blog on orofacial myofunctional science and therapy for more information. Here are some examples of people who might benefit from a speech pathologist's skills. Tiny babies in intensive care units, children with feeding difficulties or late talkers, children experiencing literacy difficulties, people of any age who can't be understood when speaking or who can't understand others, stutterers, people who develop difficulties as a result of medical conditions, accidents, injury, surgery, people in professions requiring oral presentations to large audiences or the media, singers experiencing difficulties with vocal performance, people who lose their voice or who have poor voice quality that affects their job performance or daily life, connecting with loved ones, people with disabilities, people learning English as a second language. It's a long list and there are more things, but I really hope this helps you to understand the many and varied ways a speech pathologist can help you with your communication or swallowing challenges. Remember, each speech pathologist have different pockets of expertise, but if you want to learn more about how we work at Wellspoken, a focus on disorders of function in the upper airway and myofunctional science, please have fun, take some time to explore our resources and courses on the website. Thank you so much for tuning in.